Welcome to the Dr. Berkson's Best Health Radio Show. And today we're going to be talking about healing, the real heart of healing, and how to blend East plus West. You know, just recently I was teaching at two major weekends. One's called A4M. It is a program for medical docs and nurse practitioners who want to go on and become functional doctors. It was the gut program. And the theme of the weekend is food is everything. Food drives the biome. Food is everything. And then last weekend, I was in Houston at PCCA, which trains pharmacists and medical doctors. And that was also the major theme: change your food and change your health. But the problem is, in my practice, I get sophisticated patients who have already been eating perfect food, perhaps even taking perfect balanced bioidentical hormone replacement. They come in with a bag of nutraceuticals. It's so heavy they can hardly, some patients, their bag breaks on the way that they get into my office. So people are getting the memo that food is important, but it's not the whole answer of how to get well. Achieving wellness, true wellness, is very complex, especially today in today's toxic world. So on the show today, we have a dear colleague, and if I could say a girlfriend of mine, and if you can see her if you go to YouTube.
Yes, you could say that, yeah.
Okay.
Sure.
And she's beautiful inside and out, and she's a medical doctor that blends in a very harmonious, harmonic, convergent manner, East plus West. She's one of the few people, when there were so many disasters over the last few years occurring, so many people victims of disasters, on her own, she initiated a summit for disaster survivors, and she didn't ask for any money at all. She just reached out to all of her colleagues to give tools and pearls to help people re-heal themselves, to reboot themselves from so much disaster. So I want to welcome to the show Shiroko Sokitch, a medical doctor who really cares about you.
Thank you for having me. I'm so happy to be here.
So I'm just going to give a little bit about your background, and then we're going to jump into your brand new book, which is really exciting, and it's all about healing. Your new book is called Healing When It Seems Impossible: 7 Keys to Defy the Odds. And that's the patients I see, the ones who are doing all of the stuff right, but getting the wrong outcome. So you're talking about how to heal when it seems impossible. So a lot of my tribe out there are on the edge of their seat wanting to know. So I just need to tell them a bit about you. Right now, you're a doctor who has a practice in Santa Rosa, California. I used to practice in California myself, called the Heart to Heart Medical Center in Santa Rosa. You've been practicing since 1993, and you're an expert at bringing a lot of Eastern and Western modalities together. And you were trained in general surgery, so you come from a very straight allopathic background. Then you were an emergency doc for 10 years. That kind of seems to be the theme. Pam Smith was an emergency doc for 10 years, and Carol Roberts, another medical doc girlfriend of mine, was a ER doc for 10 years. Seems like 10 years is the breaking point, and then you just got to go on to the next thing.
Yeah.
But you did that while you were attending acupuncture school. That's the really cool thing. I don't know if you know, I was a professor at the acupuncture school here, AOMA in Austin. So you just launched this week your new book.
Yes, I did.
So would you tell us first about your own story of what got you from a surgeon and an ER doc onto this path, and then how you came to write this book?
Oh, such a long story. So the reason I went into surgery was because the very first time I got to save a life was in the operating room. And I was a third-year medical student, and I was I was doing an emergency room rotation. And I remember, like, the first day on that rotation, I was so scared because I was going to see real patients, and it was the county hospital in Seattle, and so it was very busy. And I was so scared that I could hardly breathe. And I walked into that emergency room, and one of the residents threw a chart at me and said, "Go see this patient." And the guy had a cut on his eyelid, and he was drunk, and I had to figure out how to suture his eyelid, and I didn't know anything. And then that night, in comes like an ambulance with a patient, and they're screaming, "Run to the trauma room, everybody all at once." And there's a guy who had a gunshot wound. And I got to go to the operating room with the surgeons and hold the retractors while they saved his life. So it was the first time I got to save a life from that moment of door of death to life. And the reason I was so strongly into that is when I was 5, my great grandmother basically died in front of me. And she was my very best friend and the closest person to me. And I didn't know what to do when she collapsed. And my mom told me that her heart had stopped beating. And on that day is the day that I wanted to save lives. I decided I had to figure out a way to save her life, how to make her come back to life. And I've spent my whole life looking for how to help people live. So through surgery residency, in the first year of my residency, we had so many patients who were injured or sick or in pain, and we were able to save their lives from that moment of death to life. But then there was so much more to it. And I began to realize that, and because kind of at the same time, it was like a crowded field of my own emotional and childhood issues sort of coming up because I had achieved my lifelong goal. And these patients that were not, even though we were saving their lives, they were still struggling and they weren't getting all the things that they needed. And I began to ask the question,
wait. So do you mean that their life was saved, but they still weren't living a healthy, well life, an exuberant life? Is that what you mean?
Well, in a hospital, and I was in a hospital setting all the time. So in a hospital, you don't do that. You don't take them to healthy well, right? You send them home to heal, but they were still in pain. They were possibly dying from cancer, or I spent 2 months working on the burn unit as a second-year resident, and there's so much pain in the burn unit, because people basically are being skinned alive in order to try to bring their skin back to live, and the medications that we had to offer didn't stop the pain. And there was very little, and this is in the 80s, so things have changed a lot, and it's probably different now. But I was like, I've got to find a way not just to save their lives, but to help them not have so much pain. And that was for me too, because I was in a lot of emotional pain, and I was like, I got to find something for me. So I took a month off of my residency when I reached kind of a crisis point, when a lot of different things kind of fell together. And I was like, I got to take a month off. So I took a month off. And during that month, I got sick, and I was laying in bed for like 5 days. And at the end of that, I had a dream, and it was, if you stay in surgery, you will die. And it was so like clear. And I was like, okay, that means I had that experience in my life of listening to that voice, that sort of deep inner voice that guided me. So I was like, okay, what do I do next? And I didn't know what to do next. So I stayed in my residency, but I searched for what could happen. And somebody gave me a book called The Web That Has No Weaver. And it's about Chinese medicine. And I read that book, and it was so beautifully written. And it was about healing, and it was about energy and how energy flows in your body, and how to heal people using these tiny little needles, and helping them with their food and helping them with their supplements. And I just fell in love with the whole idea because it was so holistic. And that was a long time ago, and I still am in love with Chinese medicine. So I just, like, from then on, I was like, okay, that's what I'm going to do. And it was like, then life just set me up. Like I met a guy in the hospital who was a respiratory therapist who did acupuncture. He had just graduated from acupuncture school. So he kind of became my mentor because he knew more than me. I hadn't even had acupuncture. And when I left my residency, I left at the end of my second year. I went to work in the ER, and I went and had acupuncture with him, and I learned about acupuncture. And then I went to acupuncture school.
Where did you go to acupuncture school?
In Seattle at, the school is no longer there. It's now part of John Bastyr, but it used to be called the Northwest Institute of Acupuncture and Oriental Medicine.
I remember that. We had Joseph here that started Bastyr on the show too. So it's so great. There's such a bastion of holistic health there. And the term holistic is how functional medicine used to be called about 40, 30, 20 years ago. And now it's functional medicine. But That's beautiful.
Yeah. Yeah. So anyway, every semester, so I was working in the ER and going to acupuncture school, and every semester I'd go, why am I still in school? I've done enough school. You think I've done enough school, right? And something would happen. Something would happen to a patient or in the ER, or it would happen in my own body where I'd feel something. And the Chinese medicine just makes so much sense. And in the 80s, so functional medicine maybe existed. I didn't know about it then. But what I knew about Western medicine, a lot of times I'd see a patient and the answers for what was wrong with them weren't there. And whatever tests I could do didn't prove what was wrong with them. And the Chinese medicine had a whole system of understanding what was going on with that person in a different way. And so I brought the two together in a way that made sense to me. And it helped me understand what was happening to my patients. So I'd be working on somebody in the emergency room. Let's say an example, like somebody who has chest pain, crushing chest pain, but they're not having a heart attack. Well, so what's wrong with them? Why do they have crushing chest pain in that day? If you didn't have a heart attack and you had crushing chest pain, we called it anxiety. But in Chinese medicine, it would be some kind of energy imbalance that was it was usually liver energy impacting the heart and causing constraint of the energy in the chest. And so that was a bigger explanation for me. Like, it maybe doesn't make sense to other people, but for me, as I was studying all this and working with people, it made sense how they were.
So how did you combine Chinese intervention with regular intervention in the ER? And how did they
didn't.
You didn't? Okay.
They didn't let me, no.
Okay, I was wondering about that. So this was going on, you were noticing as you had your patient that was being dealt with through allopathic care, you were noticing how you might intervene if you were applying Chinese principles to that patient.
Yes. And I was able, because I'm creative, I was able to explain it to them in a way that it made sense to them. Even if I didn't explain it from the Chinese medicine perspective, I was able to take the Western medicine and say, here's what's probably going on. This imbalance is causing this. And that made sense to them. And so then they felt better.
So if a patient comes in to see you today at your clinic, your heart-to-heart clinic, which I love that name, how do you combine, when you're looking at them and they're coming in with a problem, how do you combine the East and West for that patient?
Well, I always combine them. So it's to me, they're one thing now. It's been going on for so long, because more than 25 years now. So I always look at them from the perspective of Chinese medicine. And the interview process is asking a lot of questions that include questions about Chinese medicine, questions that will isolate where the energy's out of balance. And interestingly, now I've also become certified in functional medicine, and functional medicine fits with Chinese medicine just beautifully, because a lot of the questions that we ask in functional medicine fit with the Chinese medicine philosophy. So it all becomes one. And when I examine them, I listen to their heart and lungs and do a Western exam, but I also do a Chinese exam. And that tells me which organs are out of balance.
Could you give us some example of some of those questions? If I was coming in to you, let's say I have stage 2 or 3 kidney disease, and we don't know why my kidney is not working well, and what might be some of the questions that you might ask me from both of those points of view?
Well, I would always ask, the story of what happened. So how did it evolve? When did it start? What were your symptoms? How long has it been going on? And I would ask questions that go before that time. What was going on in your life before then? And where, how were you? This is part of functional medicine. How were you born? You're talking about some of your conditions from childhood. Did you have vaccinations? Were you breastfed? All those kind of things, which are kind of functional medicine questions. And then how does your body feel? So like, is that pain, if you're having pain, is that pain worse at a certain time of day? Is it worse after you've eaten? Is it, like all these different questions that fit with, because Chinese medicine, certain organs are more prevalent at certain times of day, and they're more prevalent at certain times of year. So for example, kidneys don't just rule your ability to urinate. They rule your low back, your knees, your bones, your overall sense of having energy, big transitions in life, your physical brain, your hearing, and the emotion of fear. And they house your power of will. So the will to get things done. So kidneys are really important, right?
I've
In
heard
both
that.
Chinese and Western medicine.
You know, I always practiced with an acupuncturist for most of the time that I was practicing in California. And he used to say the kidneys were the palace of courage or the palace of fear.
Yeah.
Yeah.
Yeah. So, so I ask questions to see because even though the disease that you have might be in your kidneys, in Chinese medicine, it might not be. So you ask questions to figure out which organ is involved. And so, for example, like I said, the kidney rules the low back, the knees, the bones, etc. The liver rules the smooth flow of energy in your whole body, and and the ligaments and tendons. And so, if symptoms move around a lot, then the liver would be involved. It also rules the emotion of anger. So you can ask questions, and this is actually in my book, how to ask your own questions of your own body in order to learn to listen, because then you can isolate what might be going on. And so depending on whatever answers you have, and then when I examine you, I'll see, is it your kidneys, or is it your liver that's out of balance, or is it your heart that's out of balance? And whatever organ's out of balance, then I use functional medicine testing to understand it better. So for example, kidneys, because they rule your overall sense of having energy, they rule your adrenal glands. So it's a big deal to do with hormones, right? So I would always measure in a person who's got kidney imbalance, I would measure their hormones to look and see what was going on with them and see how their body was using them, like that.
So when someone comes in and they have a lot of different problems, how do you and people come in, let's say you are assessed by whatever practitioner to have 7 or 8 problems, and then people take supplements, nutrients for each of these problems, and it's overwhelming and you get nauseated from swallowing them. How do you prioritize what is the most important first issue to go at first?
So I have this thing called the triangle of wellness. And the triangle of wellness is, this is from the 25 years of what I do and Chinese and Western medicine together. But basically, taking your immune system, your hormonal system, and your nervous system, if those things are working, then your whole body can heal, because that's the substrate for wellness. If you have hormones, if you have immune function, and if you have a nervous system that's functioning. So I start with that. And many people, like with you, many people come to me with problems that they've had for a long time. They have that bag of supplements. They're on a good diet already. They've already listened to a lot of people. And sometimes they have a disease that they've been diagnosed with. Sometimes they don't, but they have an imbalance. And so everything is about getting this triangle of wellness functioning. So I look at their hormones. I work with their immune system.
How do you assess hormones? What's your favorite test for that?
I like to use the Dutch test.
Okay. So can you explain that a little bit to everyone listening?
I don't remember what Dutch means, but it's dried urine something, something, something.
An acronym.
Of some sort, yes. And what it is you pee on a filter paper, and you pee on that filter paper several times in a day, and then it's sent to this lab, and then they measure your adrenal hormones. And the list of hormones that your adrenals make is over 20. There's so many hormones, and it's a whole cascade of action. So all of your adrenal hormones are made from cholesterol, and pregnenolone is first, and then DHEA and progesterone are next. And then it's a chain of reaction that causes all your hormones to be produced. What I love about the Dutch test is that it doesn't just show me what the levels of the hormones are at those various times of day, but it also shows how the body uses them, which gives me a window into understanding the function of how the body metabolizes. And with hormones and with everything, it's not just what are these numbers, but what's happening, what's causing that to happen. I like that. I like to understand, especially for women who are prone to cancers and things like that. You want to know how their estrogen metabolizes. You want to know how their body uses testosterone and how their detoxification pathways work. And the Dutch test provides all that information.
Excellent. So,
Yeah.
so you measure their hormones, and that's one part of it. And how do you, so the other two parts, the immune system, how do you take a look at that?
Well, it depends on what I find on an exam and on what's going on with the person. So, of course, they've told me a story, and there's always a story of their life. But again, in Chinese medicine, how your immune system, how you handle the immune system is vitally important. There's a book, an ancient book that's like this thick that I have not read, but we talk about a lot in Chinese medicine. That is called the Yellow Emperor's Book of
Oh,
Febrile.
I remember that book. It was,
Yeah,
I was sitting in the
this thick.
shop. Yes, of Roger Hirsch, the acupuncturist.
Yeah.
Okay. Huge book.
It's 5,000 years old. But the whole idea is that if you get an invasion of something, so your immune system, your lung, is regulated by your lungs and large intestine. Your ability to protect yourself from things that come in from outside. So that's immune system, right? So, and if you think about it, every infection starts either with like a runny nose. So your nose is the outermost layer of your immune system, and your large intestine, or diarrhea. So you either get a cold, like a runny nose or a cough, or you get diarrhea. That's the first level of any kind of infection. Well, maybe not HIV, but even that one, there's probably some kind of symptom that starts early that we don't notice. But so that's the outermost layer of your energy. So the first thing is to figure out what is happening in that layer of energy. So with Chinese medicine, it's feeling the pulse, looking at the tongue, and figuring out what's going on. Like if it's complicated, let's say like I said, most of my patients have been sick for a long time.
Right.
I look for infections. So I'll have them either do a stool test. Even if there's not
comprehensive stool test, right? Different than the typical O&P stool test, right?
Yes. I use the MAP test, actually, which is a test that looks at the DNA of the critters. And I always tell my patients, I'm so happy this test exists because, if you've got a murderer, you often don't find the actual murderer. You find his DNA first.
That's a good way to put it.
So that's what's happening. Like when we do a stool test, and I've been doing stool tests for 25 years and looking for infections that I think people have, and they don't always find them. Even the really high quality, expensive tests don't always find them. But this DNA test, I often find things that people have and be able to be more accurate. So I have them do that test, or I do blood tests looking for signs of immune imbalance. So looking for viruses, looking for their CBC, starting with something as simple as a complete blood count, because we can look at the white blood cell count and see, is there something going on? That's a simple thing to do. So just looking for signs of immune imbalance. Vitamin D levels. If their vitamin D levels are really low and they're always fighting infections, then it's so simple to just take vitamin D and to improve the immune system that way,
So you mentioned the tongue. Can I just go to that for a second? What is
Sure.
a healthy? Everyone's going to want to run to a mirror and take a look at their tongue. So how do you evaluate the immune system from the tongue? What is a healthy tongue, and what are the different signs on a tongue that suggest to you that there are some immune issues?
Well, I want to stick my tongue out, but I don't know what it looks like right now. So I'm not going to. But I'm going to find a color that will show you what color it should be here.
Okay.
So hang on. So it should be like a soft pink like this.
Okay.
That's the closest thing I have to the right color. And it should have a thin white coat, and it should basically not have a lot of markings. So it should be shiny and bright. It should fit inside your mouth. So the tip of the tongue represents the lungs and heart. So if you were looking in the mirror and you're looking at your tongue, the tip would be the lungs and heart. And then the middle represents your spleen and stomach and your digestion. And then the very back represents your kidneys, and the sides represent the liver and the gallbladder. Now, mostly, like if you're looking at the tongue, it's the most of a reflection of what's happening in your digestive system. But it also, like if the tip is red, it's either that you're not sleeping well or your immune system's out of balance. So if you were thinking, is your immune system out of balance, you could look at your tongue, and if the tip was red, then it might be.
What about the
There's,
big crevices down the center when you have the big furry crevice crack, looks like the little Grand Canyon down the center of your tongue?
well, that's usually a very deficient digestion or emotional imbalance, chronic emotional imbalance.
It's so interesting because you hear
Uh,
what a sign means interpreted differently from different docs. Dr. Jonathan Wright says that shows you that you have methylation issues, that you don't handle your folate and your B vitamins well. Everybody's got this different thing, but I do agree that it does seem to reflect an issue in the gut, a deep issue in the gut.
Yeah. Yeah. Well, and I mean, methylation issues would affect your digestion, right? Because
True.
then you wouldn't be able to use your folate. So to me, like what I love is taking all of the Western science and finding how it connects to the Chinese medicine.
Like a great
And
recipe, right? Great
yeah, yeah.
recipe.
And so many things are changing now, right? A year ago, they discovered a new organ that we've used in Chinese medicine for thousands of years. So the organ is the organ that holds the space for the other organs in your core, you know. So in Chinese medicine, it's called the triple warmer, which is the space where your chest is, the space where your abdomen, and the space in your pelvis. Triple. So those are the triple spaces, but it's that fascia that holds all those organs in place. And that's recently been discovered in Western science as a new organ. But in Chinese medicine, it's this vitally important thing because it helps regulate that flow of communication between the upper, middle, and lower parts of our physical bodies, right?
So what is the name of that in Western medicine? It's triple warmer in Chinese medicine. What is that new name for the new understanding?
You know, I cannot remember. I read the article.
I haven't heard that. That's so
It's
great.
disappeared. Yeah. I'll have to look it up. I'll let you know. I'll email you and let you know.
So what happens when people have had a lot of abdominal or pelvic surgeries? I see women who've had a history of endometriosis, hysterectomies, C-sections. You look at them, and if they haven't gone on to have plastic surgery to fix everything and make it look better, you know that they have a lot of scar tissue inside this area. And I know that scars block energetic flow unless you do certain types of healing of those scars. Can you make a comment on that? Because many women today, and many men too, have had a lot of surgical interventions in their abdomen or pelvis.
Yes, or breasts.
Right, right.
A lot of voluntary cosmetic interventions. Well, so everything depends on the person. So if a person has had a lot of surgeries and has recovered from them well, then they might be doing just fine. Like for whatever reason, some people do well, some people don't. So some people form a lot more scar tissue and other people have almost invisible scars inside and outside. So it depends on, again, each individual person, but it does create an energetic shift. And in fact, I often, like if my surgery is my last resort for my patients, but if they do have surgery, I always say surgery is an opportunity for you to go from where you are right now to a whole new place. And it's a huge jump. Like healing takes place in sort of these small increments, right? And sometimes it just takes forever. But a surgery can take you from here to here in just an instant. And so it can be a huge energetic shift. And if you do it right, then you could have this massive healing if you have that experience of having had a surgery where your energy is aligned with what has to happen for your body and what has to happen for you. And so you could have a really positive experience without blockages or scar tissue causing problems.
I love paradigm shifts. I love that. So this is such a great way when you have to have a surgical intervention, you can look at it. We've been looking at crises like this. All your molecules are blown out of the way they normally have been. And once you get beyond the severe early stages of healing, it's an opportunity to put them back into a new you in a new form. Looking at surgery like this is really brilliant. Because a lot of people do have to face that. That's great.
Yeah. I mean, and think about it, like open heart surgery. I mean, how could it be anything better, right? I mean, okay, I'm not saying everybody should have open heart surgery, but when a person reaches a crisis like that and they have to have surgery to open their heart, one would pray that they actually get to open their heart, you know?
Oh, how beautifully said. Wow.
Yeah.
Wow.
So So to me, I mean, and again, it's always my last resort because I want to help people get as close to possible of healing as they can. But if they do have to have surgery, then they have this opportunity to have something massive shift for them.
I love that because in the English language, heal and holy, the word heal and the word holy come from the same root, the Old English halen. And you're kind of speaking about it using the best of science and the most sacred of science, healing and holy. Well, so in your book, which has the most beautiful cover, I mean, your book is absolutely gorgeous. And it just launched yesterday. It's called Healing When It Seems Impossible: 7 Keys to Defy the Odds. So we're going to want to all know a little bit about what are the 7 keys to defy the odds.
I would love to share that with you. This book has taken me 5 years to write. So, and it's a work of my soul, so I feel like my whole life is coming out in the world, but also how I practice medicine and how I want to help people heal. So it's very precious to me. So the 7 keys. So the idea is that our body is our school. And whenever we have a difficult health challenge, we have an opportunity to actually go through a transformation of who we are. Just like with surgery, where you have an opportunity to transform your life from here to here in a second, or in minutes, maybe, sometimes hours, but not as long as it takes usually, right? In a crisis of your health, you also have an opportunity to transform. And that is what I believe is the reason that we are given these challenges. We always think about our lives, or, I love hero stories. And we always think about hero stories as those adventures where you go out and you achieve some big quest out in the world. And so in our patterns of thinking, we think about our challenges as things that we go out and do in the world. To me, our bodies are a school just as much as our lives. And quite often the school of our body is very, very intense. When you're in pain all the time, when you're struggling with some health concern, you have to learn how to heal that part of yourself. And it's a deep journey. It's not, people I take care of and people you take care of, it's not just a sprained ankle or, I got a cold and I get over it in 3 days. It's something that goes on and has no apparent answer, which is why it's called Healing When It Seems Impossible. But it's like I invite you to a hero's journey instead of looking at it as, oh, my body has betrayed me. I'm angry at my body. I hate it. I want to just feel how I used to feel, which is what a lot of people say. Take it in a different direction. You're being given a challenge and you have an opportunity to go on a hero's adventure. And you get your team together, you get your tasks together, and sometimes it seems impossible, and sometimes it seems like you're never going to get there. I mean, we know these stories, right? And it just sometimes just seems so difficult, and yet you can still heal.
So I want to talk to you for a second about that, having been on, I'm not going to go through my story. This is your story, but I know what that feels like. And it also, when you heal one thing, and then within a shockingly short period of time, yet another huge thing shows up. So the sense of betrayal. So what you're saying is beautiful, but let's say right in the moment of diagnosis and after a few days and weeks when you're starting to not feel like you've run into a brick wall, but get your breath back a little bit after a horrible diagnosis, there is this feeling, if you've been doing everything right, or you thought, that your body's betraying you. So it's one thing to be from that moment to the hero's journey. Can you give us a little guidance about getting from the sensation that my body is not watching my physiologic back, drat, to the hero's, to I am putting on my mucklucks and taking a deep breath in my Wonder Woman costume and charging forward. So can you talk a little bit about space, going from one space to the other?
Well, so first of all, it's all about honoring everything, right? So, and the first key in my book is love. And you love this. I remember we had that conversation about oxytocin, which was very educational to me. But love is the fuel that helps bring everything into alignment in terms of the opportunity for healing. So love is the first key because it has everything to do with everything. So energy, if you think about how Chinese medicine and the whole idea of energy works, it's like everything has to do with love. You love your body, you love your healers, you love your family, you love, and if you think about how your cells work, your cells are designed to communicate with one another. Like this whole, it's like our bodies are made up of love. And so how I think about it is, okay, something has set this into imbalance. In the moment when you have a terrible diagnosis, before you get to acceptance and surrender and all of the things that the stages of grief that we talk about, you have to actually acknowledge your own grief and your own anger and your feeling of betrayal. So there's nothing wrong with that. I'm not saying never feel betrayed, because at first you're going to feel betrayed. And at first, if you have had a major trauma or something, you're going to feel in shock. And so there's a moment where you just have to hit the pause button and be in that space. So I'm not saying don't be in that space. In fact, you have to really honor that space in order to get to the next space, which would be to, okay, now I'm going to put on my muklux and I'm going to embark on this healing journey, and I'm going to find my healers and, get my team together, and we're going to do this. But that first level, that's a place where you honor and you let yourself be in that space, not in a way of self-pitying yourself.
It's a tough word.
A tough word. So it's not about self-pity. It's about, whoa, I've just been hit with something really big. I've had a life transforming moment. Whoa, I've got to sit with this. You have to sit with it.
You know what I have found, because I've had it happen to me so often, is that in the first few times I gave myself to the darkness and the scare and the fear and listened to what the docs in the white jacket said. And then the second time, oh my God, again. And then the third time is time for pause. Well, I've made it through the first and the second time, and they all were opportunities for transformation. And now with my meditation and my higher connection to a spiritual side of myself, I don't need to have all of myself go to fear. I can have part of myself observing the part of me in fear and shock, but there's part of me now that I'm connected and congruent with that can watch it. And then as the next few times occur, because as you're older, you get more diagnoses, often not everybody, then you go, okay, now I know this is my opportunity to redefine myself. And it's a process of learning how not to give 100% of yourself to the fear and the shock by having, through meditation or intention or a spiritual connection, having part of yourself that you are more and more anchored with that's not the part that's going through that. Does that make sense?
Totally. That's part of what I talk about. Yeah. And when a person like you has had so many things, I always call those people the natural healers. I've had many of my own health challenges, and I see a lot of patients like that. And I really think that when you get that many physical things that happen to you, it's because you are meant to learn to find your way through those things so that you can help others, which is what you do, right? That's your mission. So you have so much information to share because you've had those experiences of healing such deep, incredibly difficult things.
Have you noticed that sometimes people who just eat junk food and go through life, that they're not really having an intention to be more sophisticated mindfully, and that they have no health issues? And then some of the most beautiful people I know, literally they're like angels treading gently and amazingly upon this planet. Their bodies do not respond to the interventions that we know, and they're always battling with something. And I wonder if it's hard because we live on the body, mind, spirit levels. If so much of you is in spirit, really you're a champion of the spirit, maybe there's less energy available for the other bodies, or I don't know. But have you noticed this, that a lot of times the people are so highly evolved, they have so many more struggles? Maybe they learn through those struggles, maybe because their energy is in the higher planes and there's less available for the lower planes. I don't know. Can you comment on this? Because I have observed this in some of my dearest friends who help so many other people heal. So many people who are well known in the health industry who now have passed in this last year or two, who are behind the scenes, struggled for so many years, helped others, but they constantly had to struggle in their own body. I pondered this. Can you comment on this, Shiroko?
I sure can. So when I first moved to California, that was my group of friends. It was the group of people that I met and I wasn't previously spiritual when I got officially spiritual before I came to California. But
officially spiritual, love that.
I connected with a group of people various people, so there are different settings, but they were what I considered spiritually evolved. And I considered myself sort of like if you were thinking of spirituality, I considered myself to be like at the root, like down under the ground, and they were way up here in the skies, right? And it was definitely true that their bodies had a more difficult time because they were out here. And I felt like I had a particular gift because I was way down here, really rooted in the earth, which I was able to help them get more rooted in the earth so that they wouldn't have such a difficult time with their bodies. So there is, I think, a lesson for people who are really spiritual to get more grounded in the earth and connected to their physical bodies, because that's part of what's about being on this planet. But then the other thing is, again, that people who have very difficult times with their bodies are really designed to help others. And so through the learning of how to get grounded in their bodies and how to heal whatever is going on with them, they are able to use that information. And I've had certain health challenges. They seem a little bit silly compared to having cancer, but I had a knee pain for like 2 years. And I tried everything. And of course, I wasn't going to have surgery because I had surgery on my knee when I was 16 and it wasn't worth it to me. So I decided not to have surgery on the second knee when it went out. And it took me 2 years to heal it. And in the process of healing it, I became an expert on knees. And I've had, irritable bowel syndrome for probably most of my life. And it's taken me so many different routes, so many different ways of figuring things out, and so many things that I've had to try to get it to go away. But in that process, I'm also an expert on irritable bowel, so like that's how you become an expert is
I
through
know, but it's
challenges.
so painful. It's so big. I love that Ram Dass talks about, like you talk about the journey. He says that our lives are our curriculum. Yeah. And for me, for some reason, 2 years ago, I was diagnosed as going irreversibly blind. It's just huge, wow. just huge. After working with the eye clinic here for 15 years and all of the experts, now that's no longer true. I have better eyesight now with my glasses on, better than 20/20 that I've ever had in my whole life. And now the Moran Eye Institute in Salt Lake City, Utah, Dr. Alan Crandall, is using the protocols, the tests and the protocols that I did and put together after I picked myself up from crying for a month and tried to get back to that hero's journey from the shock. And now they're utilizing that. They're using it. And he goes, we made such a mistake only treating the eye rather than treating the body that the eye is, that the body that owns the eye, right? But sometimes these journeys are just, when it's just such a level that what you're being diagnosed with is so darn scary that your life would not be the same at all in any way that you know it. It's just, so going from that betrayal, when it happens. So can you outline these 7 keys? I imagine these 7 keys in your book take us from the sense of shock and betrayal to the hero's journey. And, we're all wanting to know what they are, if you don't mind sharing.
Sure, of course. But please tell me what you did for your eyes, because I have a friend who is going blind.
Well, it depends on what the issue is, but everyone in my family has glaucoma. Some of the people in my family have gone blind. I had Dr. Richie Rich on this show. He's the world's expert. He developed the trabeculectomy intervention. That's the standard. And he's been in practice, I think, now over 60 years. He's been a long time ophthalmologist and a surgeon extraordinaire. And he says that there's over 400 to 500 genes for glaucoma. We thought there were maybe under 20, but he said no. And there's almost 60 forms of glaucoma. But it's optic nerve disease, and it was aggressive and very atypical and non-responsive to what they had. And most of my people on the show have heard this, but so I worked with the Austin Eye Institute here with glaucoma specialists, did all of their surgery, saw all of their, and they finally sat me down 2 years ago. I was surrounded by a bunch of docs, put their hands on my shoulders with tears in their eyes and said, you have to get a small home, get yourself prepared. This is, going to be a life game changing. This is progressing. Anyway, so long story short, I started to do research, and then they told me that I had no right to do that research. I was a patient, and research was basically done in the universities. Well, I could no longer work with them, because if you're given a terrible diagnosis, now I know that means they didn't know what to do for me. So I found a Cuban PhD researcher who was reversing loss of visual field, which is how they check to see if you have vision loss. You do a test where you look at these flashing lights, and they assess how much vision you have. And that's called your visual field. And if you lose your visual field, they say, the doctors that I saw, the specialists, young guys, not older guys, that are well respected, that once you lose visual field, you can't regain it. But that is not really the truth. And at the Moran Eye Institute, they admit that isn't the truth, and that isn't my truth. I am regaining visual field. So I found somebody who published regaining visual field using ozone. So I started using ozone with IV and rectal insufflation. Now I do it through a stethoscope through the ears, because it gets closer to the brain, and the optic nerve is an extension of the brain. I also measured a pro-inflammatory cytokine in the blood called transforming growth factor beta 1, which has about 60 papers on it showing that if you have an elevation of this, you have much more aggressive optic nerve damage. So I measured it in myself. I was about 18-fold elevated. I was exposed to a chemical in the womb. My mother was given it as a prenatal vitamin, like millions of other women. And I called my mentors at Tulane, and I said, is there anything to do with DES daughters having elevated transforming growth factor beta 1? And they said, funny you should ask. All DES offspring exposed in the first trimester to a sufficient amount have elevated TGF beta 1. We didn't know what to do with that. Well, so then there's nutritional interventions to bring that down. And there were like 4 or 5 different things like that. So now at the Moran, Dr. Alan Crandall's running transforming growth factor beta 1 on all optic nerve patients. He is using ozone for people who are not responding to the typical little stints that they put in, which I'd already had, and the surgeries and so forth. And there's a whole way, there's a set of nutraceutical interventions, but they need to be individualized like everything else in functional medicine to deal with that. But those were 2 of the main things that I did. And then change in diet to reduce inflammatory markers. And I learned over the last few years, with having so many health issues that were related to DES, and then in the literature, they show how DES does it with driving nasty molecules. And you can measure those nasty molecules in your blood. And I do everything right. I eat the way people eat when they're diagnosed, and then they want to make a change to get better. I already live like that. And you can measure those molecules and see where they're at. And if these molecules that drive disease, such as optic nerve damage, you can say, oh, I've got elevated galactin-3, I've got elevated trimethylamine N-oxide, TMAO, I've got elevated uric acid. You could look at markers. I've got elevated transforming growth factor beta 1. And then you can bring them down through diet, nutrition, herbs, acupuncture. Sometimes medication helps bring them down. But doctors don't do that. They just say you have this disease and here's the med, or you have the disease and there's no answer. But by understanding the molecules that drive the disease, you can have somewhere else to go about why you're ill and drive the clinical traffic to get you well.
My friend has an autoimmune condition of his optic nerve. So, and I've been working with him to try to do the nutritional components, but
is he on low dose naltrexone?
No, but
he's got to be on low dose. He's got to be on low dose naltrexone. He should be on, and it's a special stethoscope that's a silicone stethoscope, and you can buy the ozone machine from Longevity, and they'll work with you to help set everything up. Ozone in the ears is incredible for eye conditions, and there's a product that's called I think it's called Macu Health, and it's got, besides xanthine and some of the other flower pigments, it's got a very unique combination of flower pigments, and Dr. Crandall recommends that, and he said a lot of people just by using that product have incredible health. So it's this whole series of things, but those things alone might be helpful. I'd love to hear down the road how your friend does. And
I will. I'll let you know. Yeah.
Maybe he should fly out to the Moran Institute, because they took me seriously. They did 20 years of analytics of my eye health and eye pressures and my vision. And then they saw that over the last year where I was doing these weird things, I was getting improvement for the first time. And then they waited till that improvement was stable over several visits. And then they started utilizing these protocols. Those are open-minded physicians. The ones here said, how dare you do any of this? Go home and go blind, in essence, is the message.
Right.
What?
No,
That's
good.
ridiculous. It's stunning.
Yeah.
So I'd be glad to help in any way I could if there's anything else I could do for your friend. But when you get these diagnoses, and if you get a number of them in your life, you go, oh my God, am I Job? Is what's going on? And so how do you hold on to that vision of the hero's journey in light of continual assaults?
Well, since we only have a few minutes left, I'm just going to run through the 7 keys.
Great. I want to hear them.
Yet. So the first one is love. And the idea is that the energy of love and the power of love. So just think about it. When you're in love, how do you feel?
Fabulous.
You feel great all the time. So just that idea. So, but how to apply that in your life. So recognizing that your cells operate on the energy of love, that your body operates on the energy of love, and that you want to surround yourself with love in every possible way. So the chapter has all these descriptions about love. It talks about oxytocin and the difference between cortisol and oxytocin and how that works. The second key is the physical balance, the three elements, emotion or immune system, nervous system, and hormones, and how to get that in balance. So the triangle of wellness.
How do you test, just in a short, how do you test the nervous system?
Well, by exam and by how somebody functions. So that's really a functional test more than anything.
Okay.
But then from the Chinese medicine point of view, I can look at the ears.
Okay.
And it can show me a lot. So there's all kinds of ways to look at the nervous system.
Thank you.
And the third key is finding your own unique lifestyle. And it starts with a detox. So basically kind of clearing out the noise, and then finding and starting to experiment. So the idea is there's thousands and thousands of diets. There's thousands of ways to exercise. There's so many ways to do things. What's going to work for you? What's going to work for you as a unique individual? The fourth key, and this kind of bounces back and forth, the listening to your body is the fourth key. And I use Chinese medicine to give people information about how their bodies work. So each organ, like I said, like if you had low back pain all the time or you had knee pain, then that might be a kidney imbalance, and what does that mean? And so the whole listening to your body chapter is about what signals is your body sending you and how can you learn to listen to those so that you can use them as tools for your healing. The fifth key is recognizing the connection between emotions and your physical body. And again, each organ in Chinese medicine rules a different emotion. And so there's emotional and spiritual functions that we have that are designed to be connected to our body. And how do those work and how do you deal with them? So each chapter has certain elements that we call fundamentals. And then each chapter has actions that you can take to understand that better. And then if you buy it on Amazon and you give me the receipt number, you get a free workbook so you can try it all out. The sixth key is called patience and persistence. The main title is Never Give Up. So whatever you have, this is that hero's journey. Whatever you have, like you, Lynn, you're the best example of what you teach, right? Is that you never give up. You went looking for answers that helped you save your vision. You went looking for people who could help you. Never just take the word of whoever if it doesn't feel right to you. Now, if there's a reason for you to give up, there's that point where okay, there's only so much you can do. But in this space, I believe that if you keep looking, you will find a solution. if you keep finding the right place. And so the chapter is about how to do that and what to look for and when patience and persistence pays off.
I love that. In my gym, when you walk through, it used to be called Pure Austin, and Life Fitness just bought it. Above the door, it says never, ever, ever give up. And I go to the gym every day and have my whole life. My mother was an athlete. It's not because of my discipline. I was raised that way. And I instruct all my molecules before I take a pause walking into the gym, and I say, never, ever, ever give up. I love that you have this in your book. You've got to go get this book. This is so important, because if I had given up, I asked the wife of the ophthalmologist that owns that clinic, what do the other patients do that are told by you that they're going blind? And she looked at me and held my hands, and she said, they go home and they go blind. And I could have accepted that. I could have, because I'd worked with them for 15 years. They're top specialists, and I didn't. And that you have this chapter in the book, you've got to get this book. It's so important to learn how you never, ever, ever give up until it's at some point where it's a transition to acceptance and peace. But I love what you just said, in this space, where you don't give up. So that's beautiful. Thank you for writing a book that contains that. What's the seventh one?
The seventh key is called trusting the process. And this is where you read that, where you meet that place where it gets so difficult, right? So when you've tried everything and you've done everything and you still don't feel better, what can you do? And this chapter was really hard to write because I kind of lived every chapter. And so to live in that place where things feel like, okay, I've done the never give up. I've done this and I've done this, and here I am. What now?
Oh, I know that space. Okay, what now then?
Well, now is the time to step in with the divine. Whatever that is for you, whatever that higher power is for you, but that is where the divine rules. And to come to a place of, okay, what do you need to do? Do you need to accept? Do you need to surrender? Do you need to let go of fear? What else can happen? So it's still never giving up, but it's this softening within. It's okay, what if nothing ever changes? Can I be peaceful? Can I live my life if nothing ever changes from this moment forward? And many people say, no, I cannot accept that. If you can come to a place where you trust that your life has brought you to this place for a reason, that there's a reason for this, whatever situation you're in, not because you're being punished, because a lot of people think they're being punished, and that's almost never the case. It's to learn something. It's to understand something about yourself. It's to explore places inside of yourself that you maybe never have. And if you get to that place where it seems so dark, then you surrender. And in the process of surrendering, you give up to a higher power that can help you. And then suddenly answers start to come. There might be new answers. They might not reverse the process that you're in, so maybe some of these people who have had to go blind because they believe their doctors, something else happened to them, where they were able to surrender on a deeper level, where they developed some skill within themselves, where they could listen better, where they could feel things in a different way. There are many things. Some of the acupuncturists that I've studied with are blind. And in Japan, they're the most famous acupuncturists because they feel everything. They can't see, but they feel.
That's the same thing. There's a very famous chiropractor that's blind. I love that you're saying that's really, so some of the most famous acupuncturists in Japan are blind.
Yeah.
Wow.
Yeah.
So I just want to say, this summer I had my very first bout of vertigo. It was just the most awful thing. And long story short, it turned out to be due to a jaw issue, which none of the ear doctors had found. But it was like an existential crisis. And I couldn't think, I couldn't live, I couldn't drive. And what helped me was to take healing quotes from the Bible and from holy books. And I wrote them in big magic markers on big white pieces of paper and put them all over my house. I had about 50 sheets of huge paper all over the house. And I just walked in front of each one and said them out loud and proclaimed them and tried to surrender to being healed and being supported by the universe. And it ultimately, my neighbor who had had this issue for many, many years, and I've been praying that I could be a conduit because she's seen over 40 some doctors. Now she's going to go be taking a look at her jaw as part of this issue for healing her.
There you go.
And finally, this is behind me, but it's so interesting what you're saying. That's what worked for me in that moment. And I had never done that before, even with being diagnosed with eyesight. But my home was just filled with these. I just took those pages down about a week and a half ago, and I kept proclaiming them and taking them into my body and opening myself up to the universe, supporting me in the face of such suffering for that component. And then it turned out that I think that's the reason why. But disease and healing. We need people like you that walk the path of the two worlds and offer answers to patients when they're not getting it. And this book, so let me tell you where you can get it, and let me give you a page where you can go to. This is Dr. Shiroko Sokitch that we've been talking with. The name of her book is Healing When It Seems Impossible, 7 Keys to Defy the Odds. She gives you steps with which to really deal with the angst, that terrible angst that comes from not feeling well inside yourself. And there's a sales page for free gifts. Am I supposed to give them the sales page? Is that?
Yeah.
Okay. Yeah. So it's http:// and the name of her clinic, Heart to Heart Medical Center. So it's hearttoheartmedicalcenter.com/book/. And it'll be in the notes, the show notes, so that you'll be able to get this there, and you'll be able to have a link to Amazon to get the book and everything. And you really, if you're going through any kind of serious health issue, if you know anyone else is going through a serious health issue, and please don't forget to go to my website, drlindsayberkson.com. I just published my most recent show, an in-depth show on sleep, and that I have an article coming out on sleep in the Townsend Letter in the March issue for Women's Health. So there's always lots of goodies at my website for you to learn more things. And I love having amazing human beings and healers on the show like we have had today. Is there anything that you want to say about how else people can get a hold of you, or some concluding comments?
Well, I always like to end with to try to remember to love. And so whatever's happening, if you can find some part of you, inside of you, that loves another person, another thing, if it's a cat or a dog or a child or somebody that you love, you focus on love. And a lot of times we have a hard time focusing on ourselves and loving ourselves. So love someone else, because any kind of love that you give will come back to you. It's like a boomerang. It's the most wonderful boomerang in the world. If you give love, it'll come back. So even if you feel absolutely desperate, or if you're having a hard time in something, find something to love.
This sounds corny, but I love that. And I try and do that throughout my day. I love to do it at the post office, to love the person that's walking in and hold the door. Yesterday, I'm going to talk about it in my next show. I had this most loving experience with the people who work there at the post office. Anytime I go throughout my life, I think of each little moment at the supermarket, at Whole Foods, at the gym with my patients, a little moment of potential connection on a level that you would love to live on, which is really living in love.
Yeah. Yeah.
So
thank you. Yeah.
I love having you on the show, because it seems like this book helps take people from the scary issue of suffering and diagnoses to figuring out how to live in love and heal themselves. So thank you for writing this book. You said 4 or 5 years of your life. Thank you for doing this. Thank you for being on the show.
Thank you for having me. It was a pleasure.
So if someone wants to be your patient, how do they get a hold of you?
Well, it's all on my website. So hearttoheartmedicalcenter.com. There's the contact information. And there are other gifts there. There's a little book about how to buy supplements and the hero's journey. And we were talking about the Disaster Recovery Summit, and it is on my website. It's still available at no charge for anybody who wants it. And it was an event that I put together to help people who have suffered any kind of disaster, including emotional and spiritual disasters, to recover on the physical, emotional, and spiritual level. So.
And you made it available for free. You are really, really the real deal. I mean, you're authentic through and through. And there's not a lot of people like that out there. Most people are more for themselves. You really are to really serve it with big capital font size letters. So thank you so much. Thank you for being on the show.
Thank you.
Everybody, take care. So that's your message for today. Tomorrow, figure out a way in some little scenario in your life that you can give love and get it back and start creating that great boomerang that she said of love. Bye, everybody. Take care.
Bye.